Okay, we're going to be looking at the lower extremity, and we're going to be doing ranges of motion first. So let's look at the hip and talk about the main primary movers. So the first action is hip flexion. This is hip flexion. This is hip extension. So the primary hip flexors are the iliopsoas, that's a hip flexor, and so is the rectus femoris. The primary hip extensor is the gluteus maximus. Your hamstrings can also extend the hip. From this perspective, we can see abduction of the hip and adduction, abduction and adduction. The primary hip abductors are the gluteus medius and gluteus minimus. When I bring the hip into an adducted position, that would be the gracilis and your adductor muscles, adductor longus, magnus, and brevis. We have hip external rotation and hip internal rotation. A primary hip external rotator is your gluteus maximus and your iliopsoas. Your hip internal rotator is your TFL, tensor fasciae latae. Okay. When I said abduction, we said glute medius and minimus. It's also TFL, tensor fasciae latae. Okay. Hip flexion, hip extension, hip adduction, hip adduction, internal rotation, external rotation. Those are the primary hip actions. Now we move down to the knee. The knee can flex and the knee can extend. Your primary knee extensors or primary leg extensors are going to be your quadriceps. Your quadriceps, quad means four. There are four muscles, three vastus sisters, the vastus medialis, vastus lateralis, and vastus intermedius. That's three. And the fourth muscle is the rectus femoris. Of those four muscles, the rectus femoris is the only one that crosses the hip joint. All the others cross the knee joint. So the primary action of the quads would be leg extension. However, the rectus femoris, since it originates on the AIIS, the anterior inferior iliac spine, it can also flex the hip. So think of it as the hurdling muscle. When you're jumping a hurdle, the hip flexes and the leg extends. The antagonistic muscles are the hamstrings. They flex the knee. Those are the semi-brothers. You've got your semimembranosus and your semitendinosus. Those are on the medial side of the back of the thigh. On the lateral side of the back of the thigh is the bicep femoris. So their primary action will be knee flexion, but since they originate on the ischial tuberosity, they can also extend the hip. So they extend the hip and they flex the knee. Those are the actions of the hamstrings. Now we move down to the next joint, to the ankle, and the foot can dorsiflex or plantar flex. Dorsiflexion is when you're walking on your heels. Plantar flexion, reach for the sun. Plantar flexion, reach for the sun. That's stepping on your tippy toes. Your primary dorsiflexion, your primary dorsiflexor is tibialis anterior. Tibialis anterior dorsiflexes the foot, which looks like this, and it inverts the foot, which looks like this. So it dorsiflexes and inverts. That happens to be innervated by the deep peroneal nerve. So people that have a weak tibialis anterior or damage to the deep peroneal nerve get a condition called foot drop. And rather than walking and having the foot and toes drag, these people have to walk taking a very high stepping gait. We call that steppage gait. The plantar flexors are the muscles of the back of the calf. Three main muscles that do that. The gastrocnemius, the soleus, and the plantaris. Of those three, the soleus is the only one that does not cross the knee joint. The other two, the gastrocnemius and the plantaris, cross the knee and the ankle. So the general rule of thumb is if a muscle crosses the joint, it has to act on the joint. So that means that the gastrocs, the soleus, and the plantaris, all three of them, since they cross the ankle, will plantar flex. But the gastrocnemius and plantaris, since they cross the knee, can also flex the knee. They're weak knee flexors, but they can do it. Okay? So that brings the whole lower extremity, their primary actions, to a close. I'll do a quick review, just demonstrating the actions. Hip flexion, hip extension. Hip abduction, hip adduction. Hip external rotation and internal rotation. Keep in mind, it's the femur that's rotated. The foot comes along for the ride. The greater trochanter is the reference point. When the greater trochanter goes out, that's external rotation or lateral rotation. When the greater trochanter moves in, that's internal rotation or medial rotation, and the foot comes along for the ride. Then we have knee flexion, and extension. Knee flexion and extension. Foot or ankle dorsiflexion, ankle plantar flexion. And the toes, my shoes are on, but the toes can extend up, or when they curl down, that's flexion. The other name for that, when the toes extend up, we call that dorsiflexion of the toes, or extension of the toes. And when the toes flex down, we also call that plantar flexion of the toes. Okay, so we hope you enjoyed that review of the actions. Stay tuned. We are now going to move towards the muscles of the lower extremity. Thank you.